Hello, my name is Angie and I will be educating you on HIV and AIDS prevention. It is important to know about this worldwide illness in order to work towards preventing it, as well as eliminating the stigma surrounding this disease. HIV is the human immunodeficiency virus, a virus that attacks the CD4 cells, often called T cells, which help the body fight infection, making a person more vulnerable to other infections and diseases. There are three stages of HIV. Stage 1 is acute HIV with flu-like symptoms that occur days to weeks after contracting HIV. Stage 2 can last for years if properly treated, and stage 3 is known as AIDS. AIDS is the acquired immune deficiency syndrome. In the absence of treatment, around half of people infected with HIV develop AIDS within 10 years. People with AIDS have an increased risk of developing cancers and respiratory tract infections. The effects of HIV in the body include fever, weight loss, headaches, skin rashes, gastric problems, myalgia, and sores. Symptoms of acute infection may take place days to weeks after the virus has been contracted because the virus has been multiplying in the body. HIV/AIDS is believed to have originated in non-human primates in Central and West Africa. The first reported case was in the Democratic Republic of the Congo in the 1920s. Research shows it was transferred from chimpanzees and gorillas to humans. HIV/AIDS is not a disease that can be detected by just looking at a person. It can easily be your coworker, your classmate, or that cute bartender you were checking out. This disease does not discriminate based on gender, ethnicity, or the way you look, education, or social status. HIV/AIDS can be caught by unprotected vaginal or anal sex from mother to child through pregnancy, birth, or breastfeeding, by sharing needles, especially when injecting drugs, by working in healthcare, or also by blood transfusions or organ transplants, although not common. Unfortunately, 1 in 7 people around the world are living with HIV and are unaware of their infection. Most of this unaware infected population live in poor countries with little to none resources. Many are also sex workers or part of sex trafficking that use no protection. Symptoms of HIV occur within 2 to 4 weeks after infection. You may experience flu-like symptoms such as fatigue, fever, sore throat, swollen lymph nodes, headaches, loss of appetite, or skin rash. During this period, the immune system is learning to recognize HIV. Although many myths around the transmission of HIV exist, individuals cannot become infected through contact such as kissing, hugging, shaking hands, sharing personal objects, food, or water. It is not transmitted by air, water, insects, pets, saliva, sweat, tears, or sharing the toilet. The World Health Organization established World AIDS Day, which started on December 1st, 1988, and has been celebrated ever since to bring HIV and AIDS awareness. They also sponsor different assemblies and strategies for HIV prevention. Approximately 1.1 million people in the US are living with HIV today. The majority of people infected and at risk for HIV/AIDS in the US are gay African American males. African Americans account for 43% and Latinos account for 26% of HIV diagnoses. There are approximately 36.9 million people worldwide living with HIV/AIDS, and 53% of those are in Eastern and Southern Africa, 16% in Western and Central Africa, 14% in Asia, and 6% in Europe and North America. The Centers for Disease Control recommend that everyone between the ages of 13 and 64 get tested for HIV, especially those with risk factors. Testing can be done with a blood sample at a hospital or clinic. As of now, there is no cure for HIV/AIDS, but a number of HIV vaccine trials show encouraging results. However, a vaccine would only offer partial protection and would need to be used in combination with other prevention and treatment options. Current treatment for HIV/AIDS is through antiretroviral therapy known as ART. The main goal of ART is to reduce a person's viral load to an undetectable level. People with HIV who maintain an undetectable viral load have effectively no risk of transmitting HIV. Modern HIV drugs can keep people healthy for decades, but if you take them, you could be facing well over $400,000 or more in lifetime costs for HIV treatment. The average cost of HIV treatment is $14,000 to $20,000 a year. HIV prevention programs are interventions that aim to halt the transmission of HIV. They are implemented in the community or rolled out as public health policies. Many states require their students to take sex education to teach about sexually transmitted diseases. To reduce your risk of HIV infection, use condoms correctly and every time you have sex. Today, there are more tools available than ever to prevent HIV, such as abstinence, limiting your number of sexual partners, and taking advantage of HIV prevention medications.